Hi, and welcome to the Grace Supportive Care webinar series. My name is Ramy Sedhom. Today we are joined by Dr. Stewart, medical oncologist at UCSD Moores Cancer Center, who specializes in the treatment of patients with genitourinary cancers. Today, we will be discussing the side effects of androgen deprivation therapy, a common treatment in prostate cancer. Dr. Stewart, thank you for joining us.
Hey, thanks so much for having me.
So, Dr. Stewart, how do you typically describe androgen deprivation therapy to your patients?
Yeah, so when patients come to me and they have a new diagnosis of prostate cancer or need treatment for their prostate cancer, androgen deprivation therapy is one of the hallmarks to our treatments. We either use it by itself in patients who have kind of advanced disease, or sometimes in combination with radiation therapy for localized disease or salvage therapy after they've had prostate cancer and they've had their prostatectomy and their cancer has come back locally. Sometimes we'll use ADT with radiation therapy. And what I tell people about it is that it is medication that essentially brings your testosterone down to nothing. Turns out that prostate cancer is a cancer that feeds off of testosterone. We essentially try to starve it. And by doing so, this can be a very great treatment for patients. In patients who have advanced disease, metastatic disease, this treatment can prolong life for years at times. And so it's a hallmark to prostate cancer therapy.
That's great. And one of the things that we commonly hear from patients is that there are unique side effects to androgen deprivation therapy. What is the most common one you typically hear patients complain about?
Yeah, Ramy, so absolutely. So we're talking exactly about the side effects today, and that's what I want to emphasize. And, we'll go over it, and I won't pull any punches. I'll tell you exactly kind of what to expect so that patients who are listening to this and are thinking about it in the future or getting ready for ADT have a good idea. The one thing that I would step back and say, once again, is just how important, how useful this therapy is. This therapy, like a lot of therapies for cancers, has side effects, and those side effects can affect people, and some can have major side effects, some just have annoying side effects. But the point is that this therapy can make people live significantly longer than if they did not have it. And really, there's just a huge amount of benefits. With that being said, there are unique side effects to it. And so I spend a lot of my days talking about these. The most important, and the one that I hear about the most commonly, is fatigue. So guys will come to me when they're on ADT and they're a couple of months into it, and they'll just tell me, it's like the wind is knocked out of my sails. And they'll say, yeah, I'm able to go about the day, but I just don't have the same amount of juice going through it. If people hear about this on the internet or read about fatigue, this is not the kind of fatigue that keeps you in bed all day long. There are some patients that may have significant fatigue, but the vast majority of patients, their fatigue is something where, if they are athletes, they may not be able to perform this at the same level. Otherwise, if they're, regular old guy just going about his daily business, he might find that, if he sometimes takes a nap in the middle of the day, he's more apt to take a nap in the middle of the day. Might find in the end of the day he's a little bit more tired. Sometimes they just find that they just don't have the same amount of energy to do a lot of things. With all that being said, people are still able to do all the things that they want to do in life. They might just not do as much. I get patients, especially where I'm at, who love going swimming. You can go swimming, you can go biking, you can do all sorts of things. But you might not be able to swim for as long as you normally did. Or you might not be able to bike for as far or as fast as you were, but you're still able to do the things that you want to do. But no doubt, it is something that I hear about, and it's a real thing.
Thanks for sharing that, Dr. Stewart. In addition to fatigue, are there any common physical changes that patients notice?
Yeah. So, testosterone is one of the major hormones in men's health that keeps muscles strong, keeps weight off. So it really helps with your metabolism. That's what I tell patients. So in patients who are on ADT, if you're on ADT, there's a good chance that you could gain weight And it's all the weight you don't want. It's all central weight. Now, when I talk to patients about ADT and when they're starting it, I tell them, you don't have to gain weight. The way that you can stop yourself from gaining weight is just cutting the calories. Generally speaking, if I have everyone do the exact same thing they were doing before ADT, you're eating the same amount, working out the same amount, then you're going to gain weight. But if you decrease your calories somewhat, you can maintain your normal weight. The other really important thing is that it can decrease your muscle mass. And it decreases the muscle mass in some of the major muscles in your shoulders, your upper arms, and your thighs and your hamstrings, kind of some of your core muscles. People ask me what they can do to prevent that, and I tell them exercise. And they say, well, listen, doc, I already go to the gym or I walk or whatnot. That's all great and great for your cardiovascular health. But what I tell patients that they need to do in order to keep their strength up is they have to do weights. So they have to do weight training. So I usually tell them, if you're a member at a gym, get a personal trainer for a couple of days who can help you specialize with learning a couple of exercises to really do strength training in your upper arms, your chest, and your legs. And then, do that a couple of times a week, trying to maintain that strength. If you don't do that, you will lose strength. And certainly that will be, it's not great to feel like you don't have strength. Plus, if you don't have the same amount of muscle mass, you're more apt to put on a little bit more weight too. So exercise, and watch the diet.
Absolutely. And to just summarize some of what you've said so far, it seems that fatigue is a very common symptom.
Yeah.
And in addition to that, patients may experience weight gain and muscle loss. How does this potentially tie into cardiovascular health?
Yeah, so ADT has been associated with an increased risk of diabetes and an increased risk of heart disease as well, likely linked to the two things that we just talked about. So I talk to people about, if you want to avoid the risk of diabetes and avoid the risk of heart disease, got to eat well, got to exercise. There's also something called the metabolic syndrome that ADT can be associated with. Again, all kind of linked to diet and exercise. Keep the weight off. Likely you can help mitigate a lot of these side effects.
Great. Now, one of the more taboo things to typically discuss in a doctor's office is sexual health. How does that tie into ADT?
Yeah. So in my clinic, it's not taboo at all. We talk about it every day because it's important. And ADT certainly can affect sexual health. It affects sexual health in two major ways. The first important thing is that it can cause erectile dysfunction. A lot of patients who come and see me, they've had prostatectomies or radiation, so their erectile dysfunction may already be, they may already have some erectile dysfunction. The ADT will certainly worsen it. And if patients have not had any of that treatment before and they have normal erections, then it can sometimes, cause erectile dysfunction. I refer a lot of my patients to our men's health clinic here. Those guys they're awesome. I think drugs like Viagra can sometimes be effective, but there are lots of other medications that we sometimes think about that we have a discussion about, either in my clinic or one of the urologists over at the men's health clinic to kind of help with maintaining erections. The other thing that ADT does is it decreases your libido. So one of the other things is that not only does it give you erectile dysfunction, it decreases your sex drive. That can have significant impacts on my patients' lives, on their partners' lives, their partners' relationships. The truth is that I have an open and honest conversation about the risk and benefits of ADT. I talk to my patients about this. I think when they know that this is likely going to happen, it's easier than if people don't hear about it and doctors don't talk to them about it.
Absolutely. And it's great that you have those conversations in clinic with your patients. One thing that I appreciated was you sharing a close relationship you have with urology. Are there any other non-pharmacologic interventions the urologist may offer for some of your patients?
Yeah, so absolutely. So for lots of these things, so they're actually regarding the sexual health, there are devices to help maintain erections specifically. Those are sometimes used. There are actually other drugs that you can use, not Viagra, but that are kind of inserted at the tip of the penis, or actually little injections into the penis that can help with maintaining erections. In addition to those things, lots of guys, when they have prostate cancer, have a lot of other symptoms as well. They've had radiation or surgery. They can sometimes have a little incontinence as well. Having a good relationship with your urologist is super important. They can usually help with a lot of these things. Usually these things don't go away, but we can significantly improve patients' quality of life while they're on ADT.
Great. And moving on, are hot flashes a common symptom that you hear about?
Yeah, hot flashes are very common. So I tell all patients they're going to have a hot flash. The statistics are something like 85%. So I just let patients know. Hot flashes are these symptoms where all of a sudden your body can have this warmth feeling. These usually last 20 seconds to a couple of minutes. Usually they're a minute or 2 minutes. I've had some patients where they last longer. That's not the majority of them. And these can happen in different amounts. So most patients will have a couple of hot flashes either a day or a week, and they'll be bothersome, but patients usually can go about their daily lives and it's no big deal. Some patients have very few. Every once in a while, I'll have patients that have hot flashes that are significantly affecting them. They happen while, the patient is trying to sleep, keeps them up at night, and they can't sleep well, or it affects their work. Patients are able to work on ADT no problem, but these hot flashes can be bothersome. If hot flashes are an issue, we have lots of medications, a lot of interventions that we can do to try to help this. The biggest issue that patients have is when they have hot flashes, they don't tell their doctors about it, because there are lots of good medications that we can try to help with the side effects. Again, not all of these drugs that we have will cure the hot flashes. They won't get rid of them altogether, but they can significantly make them better. Some of these medications are a drug like venlafaxine, which is a drug that's used for depression and anxiety, but can also significantly help with hot flashes. There are some other ones as well that we use, a drug called gabapentin that can be helpful, and some other ones as well. The most important thing is if you start having hot flashes, you got to tell your doc, because there's usually something that we can do to help it out.
Thanks for bringing that up, Dr. Stewart. In an analogous fashion, a lot of women who are treated with hormones for breast cancer, in addition, complain about mood changes. Are those things that you typically notice for men with prostate cancer?
Yeah. Ramy, I actually usually hear this from the partner, usually not from the patient. And some people will tell me that, people can get a little, snarky. It's usually mild. There are a few patients that I've had who have had a history of depression where they can actually get some significant depression while they're on ADT. That's not the majority of patients, but something that we watch out for and screen for in my clinic. Most patients, the mood disorders that happen, depression or some irritability, is kind of mild and not too significant. When it is significant, one of the things that we do is, again, we talk about some of these medications like antidepressant medications that can help mitigate these side effects. They can be extraordinarily effective. But mood changes can happen.
And last common scenario that you mentioned previously is the importance of bone health. So how do you discuss that with your patients?
Yeah. So it turns out that patients who are getting ADT, it thins your bones. So when patients are on androgen deprivation therapy, they are at increased risk for osteoporosis. Usually what I do is I actually check their bone health at the beginning of treatment. This is by something called a bone density scan. This is not a nuclear bone scan that people get to look for prostate cancer that's spread to the bone. but a bone density scan that looks for how thick your bones are. Based on what this shows, sometimes we put people on bone strengthening agents. Generally, all of my patients, I tell them to take vitamin D and calcium. I usually tell them to take vitamin D about 1,000 international units a day and 1,000 milligrams of calcium a day. Patients who have heart disease, there's some mixed literature about calcium and heart disease, so I talk to patients about risks and benefits. If patients get a bone density scan and they already are at risk for having a bone fracture or have thin bones, then sometimes I put them on a medication called a bisphosphonate to help strengthen their bones. Usually I check their bone density at the beginning of treatment and every couple of years while they're on therapy. If they begin to have osteoporosis or are moving towards that, we'll sometimes start a bisphosphonate at that time.
Great. And common question we typically hear in clinic as well for smokers or those who socially drink alcohol. Do we know of any of the benefits of withstanding for at least smoking as it relates to bone health?
So generally speaking, what I tell my patients is don't smoke. Like there's the literature on smoking is just so bad that I tell my patients, if you can do one thing, stop smoking. In terms of alcohol, what I tell patients is, limiting their alcohol to, some kind of social drinking seems acceptable. There are some medications that we use in prostate cancer that can affect the liver, and so we are sometimes hesitant about alcohol in those situations, but most of the times a drink a night, a couple of drinks throughout the week is no problem.
Great. Well, thank you so much, Dr. Stewart, for talking with us today. We hope to have you again for the Cancer Grace webinar series.
Yeah, it's been great, Ramy. I've enjoyed talking with you about it. Please let me know if I can help you guys out in any way.